Many scientists think that everybody develops cancer over their lifetime. In the patients where the immune system, your body's immune system is able to control the cancer, you never know you had cancer. But in those patients where the tumor has gotten smarter, has learned how to become stealthy, it escapes the immune system's control, and then it grows out, and that's when people identify that they've had cancer. So immunotherapy is trying to boost all those different perspectives of your body's immune system to make it stronger, to help educate it so it can actually eliminate the cancer. One of the things patients should know is that to go on a clinical trial is not being a guinea pig. To go on a clinical trial is making access of the most cutting-edge advances in therapy that are available to you anywhere. And to consider going on clinical trials as a first option whenever possible. And that's what's fairly unique in terms of our setting, is that we have such a high percentage of the investigators here. Essentially every one of my colleagues who work in basic laboratories have clinical trials that have grown out of their laboratory work and are being offered to patients here in Portland, for the patients in Oregon, and in many cases those trials are not being offered anywhere else in the world. In general, people don't like to use the word cure around cancer patients. It's a tough word to use because you've got to have a long-term follow-up to know that those patients' disease is gone and isn't coming back. But now there are scientists and physicians that are using that word cure, and they're not using it lightly. They're using it because we have follow-up data now that's out 30 years, and that people who have been treated with immunotherapy and have experienced complete remission have essentially a 90% chance of 20-year or greater survival with immunotherapy. It's evidence that essentially the immune system can cure patients of their cancer. We have to figure out how to make that work better in a higher percentage of patients, and that's what we're working to do. And that's what the main research effort is here at the Research Institute here at Providence Cancer Center. It's all focused on cancer immunotherapy. Everybody here works on cancer immunotherapy.